Welcome to the media briefing today. Today, the speakers are Dr. Albert Au, Principal Medical and Health Officer of the CHP, and Dr. Larry Lee, Hospital Authorities Chief Manager. First, Dr. Au will tell us about the new cases. Good afternoon, media friends and members of the public. I now report to you the cases reported on the 18th of June, yesterday. For locally infected cases, we had 1,161 cases, including 416 cases directly tested positive via PCR test and 745 cases tested positive via RAT and confirmed by PCR test. And yesterday, we had 115 imported cases. So far, in the fifth wave, we have had 1,214,053 positive cases. Yesterday, we recorded 115 imported cases. Among them, 54 were caught at the temporary specimen collection sample center at the airport. 46 were identified during hotel quarantine. The remaining 15 are positive cases after hotel quarantine. For deaths, we have 2 new deaths yesterday. So far, in the fifth wave, we have 9,182 deaths. For residential care homes, we had 3 reports from residential care homes yesterday. First, the Hong Kong Chinese Women Association Wong Chan Shuk Ying Memorial Care Home at Kwun Tong. One carer tested positive. She last worked on the 17th. She developed symptoms on the same day and was tested positive by RAT on the same day. 13 residents are listed as close contacts. The second one is Hiu Guang Care Home for the elderly people in Kwun Tong. A carer was tested positive on the 16th of June. Besides cleaning, she was also responsible for feeding residents. She was tested negative on RAT on the 16th and 17th. 7 residents in the care home were classified as close contacts. The third one is Sha Tin Joki Home Xining Care Home. 1 resident and 1 part-time physiotherapist were confirmed. The resident was tested positive on RAT on the 18th of June in the afternoon. The resident has no symptoms and has 2 doses and is now hospitalized. For the part-time physiotherapist, the last working day was the 17th of June. On the 15th, the therapist performed phlegm suction for a resident with gowns on. She was tested positive 2 days later with a CT value 24 or 25. We are seeing if anyone has to be classified as close contacts, and we are arranging a round of PCR tests for carers and residents in the care home. For other clusters, now, for the operation units, the counter-terrorism response units under the police, there is 1 new case. He was tested positive on the 17th of June via RAT. So far, for this unit, there are 23 cases, all males, aged between 27 and 50. In the same unit, there are a total of 139 people. Most of the 23 cases are clustered in a team. There are altogether 3 teams under the unit. Besides the 23 cases, the remaining 116 police officers have been tested negative on RAT and PCR test. We advise them between 22nd and 23rd of June to undergo 1 more round of PCR test. For the team with more cases, about 20 cases, we have advised the team to suspend work. According to the epidemiological investigation, it is possible that during the meal, they would take off their mask, and according to some cases, when they are out for work, they would eat in the vehicles with mask off. as well as during training and during shower in the changing room. That might be the transmission route. In terms of genome sequencing, we have found 14 suspected BA.2.12.1 cases yesterday, including epidemiologically linked cases. 1 case was imported, 6 were untraceable, and 2 were epidemiological link with the 2 untraceable cases. The first one is a case living in Hongxing Garden, Changguanlou, Block 4. The second one lives in Shangshui. The second one lives in Jiayu building in Shamshuibo. The fourth, Sandosing, second phase, Block 6 in Zhangguanlou with 6 cases. The fifth case lives in Park Yoho Genova at the Taimei section of Castle Peak with 2 cases in one family. The last case lives in Mount Davis, Huatinggok. And yesterday we had 5 suspected BA.2.12.1 cases with links with previous cases, including 3 living in Wan Chai Changheng building, which has reported cases before. The 3 new cases today, 1 lives in a subdivided unit where cases were reported before. The 2 other cases lives in another flat. There are also 2 linked cases living in a Po-Tin building in Yulai Street. We have had cases from that same building before. For the Homentin construction site cluster, there is no new cases. There is no new case today. For BA.4 and .5 cases, we had 9 such cases yesterday. 4 were imported. The remaining 3 are the 3 family members of the workers at Regala Sky City Hotel. That is a BA.5 cluster. In summary, for the past few weeks, for locally infected BA.4.5 cases so far, we have some 250 locally infected BA.2.12.1 cases. The source was a couple from the U.S. Who tested positive on the 12th day and then caused community transmission. Among the 250 cases, some 80 are untraceable. The remaining 170 cases are linked epidemiologically with the other cases. We have found them through close contacts tracing and investigation. The biggest cluster is the McDonald cluster with 41 cases. 1 untraceable case is linked with the Hong Kong Convention Exhibition Centre's canteen for staff and another building. For that cluster, we have 14 cases. The remaining untraceable cases are scattered over different districts in Hong Kong. For cases with epidemiological links, with these cases, they are mostly patients' family members. Still, we have seen some vertical transmission within certain buildings. With more than 1 patient, we have 14 such building blocks with vertical transmission. We have found 3 restaurants with small-scale clusters with more than 1 case. For schools, we have 2 cases. At workplace, we have found 2 with transmission. In terms of severeness of the illness, so far in the 250 cases, no one require hospitalization at ICU or deaths. Most of the cases didn't even require hospitalization, and we have no secondary infection so far. For the BA.2.12.1 cases, the characteristics are similar to the BA.2.2 of Omicron. The new subvariants, however, is proven to have higher transmissibility, so we are adopting more prudent measures. Once these cases are found, we will arrange the patients to check into isolation center. and the family members and close contacts to quarantine centers. That's all.
Dr. Lee, please. Thank you. The hospital authority, we see a total of 461 patients in hospital, and 70 of them are newly admitted. Out of those in isolated wards, 137 in isolated wards and 7 in second-tier isolated wards. And then there are 110 patients who are currently being treated in North Lantau Hospital, Hong Kong Infection Control Center, out of which there are 58 new patients. Yesterday, we did not report any patients with critical or serious condition, and now we have 15 in critical condition, 8 in serious, and 2 are in ICU. I also have to report 2 patients who passed away yesterday. 2 of them are both males, 52 years old and 80 years old. They did not live in elderly homes. For the 52-year-old, he has been triple jabbed, and for the 80-year-old has been double jabbed. For the 52-year-old male, he has high blood pressure, diabetes, and also kidney and spleen infection, and also heart condition. He needs dialysis because of a kidney failure. And then he was admitted to hospital on May 15th. At that time, he was suffering from dizziness, and in his PCR test, his condition was unknown. But then because of an infection in his blood and some sort of a skin condition and low sodium, high calcium situation, he was then moved over to Pork Oil Hospital. And during that time, he was given different antibiotics. His lungs were clear, but his situation deteriorated, and on June 18th, he passed away midnight around 12:14. For the 80-year-old, he was double jabbed, also high blood pressure, and previously suffered from a stroke. And on June 1st, he was admitted to hospital at Queen Elizabeth Hospital because of dizziness, and he was found positive with a CT value of lower than 20. And at his second day in hospital, he changed to a critical condition and continued to deteriorate until he passed away around 3 a.m. on June 18th. In the past day, there were 88 patients recovered, and 32 of them were discharged. As at the 5th wave, altogether 51,230 patients recovered, out of which 50,844 were discharged from hospital. And since early 2020, 63,610 patients recovered, with 63,234 discharged, and 1 person was detected positive upon admission, and 8 were deemed as close contacts. For HA staff, currently there are 23,836 tested positive, with 23,721 of them returning to their work posts. We now move on to the Q&A. Please use a microphone and identify your media organization before you ask your questions. Good afternoon from Hong Kong 01. I'd like to ask about the current situation. Do you think that there would be a daily tally of 2,000 to 2,000 cases? A person reported that he took a taxi to hospital and then took an ambulance to hospital. He didn't need to be admitted to hospital and wanted to take a COVID taxi back home. But then he was refused a ride, and he was afraid that he shouldn't be taking public transportation back to his home, and was afraid that he would be breaching the law. So what could he do? Let me first take the first question, and then I will see whether Dr. Lee has anything to add. In the past 2-3 weeks, we see that all indicators showed a surge in infection rate, and we see an increase in transmission chains. So from the beginning of June, with 300 cases a day, we see a gradual increase till about 1,000 a 1,000 cases a day. So it's a stay around 1,000 a day. We foresee that this would remain for some time, mainly because of the relaxation of social distance measures, and people are gradually resuming their normal lives with normal activities. At this moment, the vaccination rate has already been enhanced, and there are many who were infected in the fifth wave who still have antibodies. Some indicators, including admission rate and deaths, are still actually at a stable rate at this moment, and therefore we are not too worried. We hope that for those who have not yet been fully vaccinated, please do that as soon as possible, because the inoculation can help protect your health and can help prevent serious conditions or deaths, especially for those who have recovered after being infected in the fifth wave. I do call upon for those to be inoculated as soon as possible. For COVID patients who went to A&E and wanted to return home, before the pandemic, for a patient who is bedridden or needs a wheelchair, our usual practice is to arrange a non-emergency service for them, and this remains in place still. However, for those who are not bedridden or confined to wheelchairs, we would suggest them to use a point-to-point transportation, and they must adopt measures such as wearing a mask to try to reduce infection. But then for the COVID taxis, I suggest you take this to the transport department. Next question, please. Good afternoon from Now TV. Previously, experts seem to find COVID being very similar to flu and cold, and there is no need to actually report the number of cases. Would you consider that although cases remain at 1,000 a day, many of them are actually only suffering from mild symptoms? Would you not use the number of cases as indicators and instead use the condition to determine whether you need to report it or not? Would you be afraid of having an outbreak with the July 1st celebrations? Would there actually be a tightening of social distancing measures? Thank you for your question. In this surge of pandemic, the majority of them are mild cases, mainly due to the higher vaccination rate than in the fifth wave. Many of them have received 2 jabs or more, and with the vaccine pass requirements, more and more people have been triple jabbed, and this can help prevent serious and critical conditions. Although we see an increase in the number of cases, indicators such as deaths or those needing ICU have dropped. We'll need to explore different indicators to see whether there is actually a higher load on the hospital capacity. We do not want it to have a negative impact on hospital services, especially in public hospitals. We are still going to keep our measures to ensure that we could keep number of cases to a minimum. And of course, we would consider tightening measures as needed and then reporting the number of cases. But other than these numbers, we would also consider sewage monitoring indicators to look at the future trend.
Second question on the 1st of July arrangement. Social distancing measures have been relaxed. Looking at the number of cases, we have higher risk of transmission. We have more transmission chains with multiple outbreaks. So we hope that at this stage, members of the public can maintain highly vigilance and comply strictly with preventive measures, including personal hygiene and rapid tests, especially for high-risk groups. We certainly don't want to see exponential growth of cases. Next question, please. Good afternoon. I'm from Cable News. Now, for the two deaths today, for the 52-year-old male. In May, when he was hospitalized, was he already confirmed, or was he tested positive after the operation? Now, about the resident at the Jockey Club home for hospice, did the residents go out to the community, or was the infection caused by the physiotherapist? For the 52-year-old patient, he had different chronic diseases. He was sent to the A&ED of Tien Shui Wai on the 15th of May. On the 25th of May, the test results was unconfirmed. The other tests were all negative. So what was his source? Was he infected in hospital? We are not sure. On your second question about the Jockey Club home for hospice, there are two cases, one resident and one part-time physiotherapist. Maybe I was wrong. I said it wrongly just now. The physiotherapist was tested positive on the 18th of June. The residents always stayed at the care home, and for most of the time, he was staying in his own room. He received a visit from his family members a few days ago, but his family members are still tested negative at present. So we don't believe it was caused by the family visit. It is most likely that the carers have got him infected. But among carers, we have only identified one case. That is the part-time physiotherapist. On the 15th of June, he performed a phlegm suction for the residents. He wore sufficient protective gear. He last worked on the 17th with a negative test. On the 18th, because of the positive results of the residents, we arranged a PCR test for the carers, and the carer was tested positive with CT value 24 or 25. It is possible that during the infectious period, the carer passed on the virus to the residents during work. But we don't rule out other carers having come down with the illness. We have to perform a more CTR test before we know. This morning, the round of PCR tests came back negative for all carers. We will continue to monitor the situation. The gentleman over there, AM 730, about BA.4 on .5, you said there were 9 cases. So 4 imported cases and 3 from the Regala Hotel. So where did the other 2 come from? For confirmed and or suspected BA.4 or .5 cases in Hong Kong, how many are there in total? Now in Macau, cases are surfacing again. So would we adjust entry requirements for Macau, or is it or will there be no adjustments because compared with other countries, the Macau situation is very mild? You said it is within the expectation that the number is high. So do you think we will reach 3,000 or 5,000? Any thoughts on that? Now, Dr. Lee, the 52 deceased patients, the 25th of May sample was unconfirmed. The other samples were all negative. So are we just treating him as a positive? That's why you are announcing this patient. So maybe I was mistaken just now. The suspected BA.4 or 0.5 cases discovered yesterday was 7, not 9. 4 are confirmed imported cases. The remaining 3 are the family members of the Regala Sky City Hotel resident. So altogether 7. For BA.4 or 0.5, most of the cases are imported. For BA.4, there are at least 34 imported cases. For BA.5, 62. Locally, we only have a few BA.4 or 0.5 cases. We don't see any spread in the community. One case involved a person working as the apron of the airport. His family members and his colleagues are all fine. So, and also there are 3 workers who work in the Regala Sky City Hotel are all BA.5 cases. The some 122 staff members in the hotel have all been tested, all negative. For the 3 workers, family members of 2 of the patients were tested positive, and there are no other cases that we are aware of. So it is really difficult to predict how serious the epidemic will get, but there is no evidence supporting an exponential increase, unlike what we have seen in late February and March, where the number had doubled in 2 or 3 days. Yes, we do have an increase, but it is a gradual one. Through complying with social distancing measures, we can put up the safeguard despite relaxation of social distancing measures and the return to normalcy. We should all keep vigilant to avoid being infected and quarantine. So we will keep monitoring the trend of the epidemic. We cannot foresee how bad it will get, but it is very unlikely that we will get back to the situation back in May, because the vaccination rates and the community and the herd immunity level is quite high. Professor Yuen Kwok Yung of the University of Hong Kong has predicted that some 90% of the population in Hong Kong are immune. So we don't expect an exponential increase. Still, there are some people who are not fully vaccinated and have not been infected, and they are still at risk. So we will keep monitoring the figure. Sorry, can you repeat the third question? Depending on the Macau situation, will we adjust entry policy for Macau citizens? Now we have cases in Macau, so will the Hong Kong government adjust the entry policy for Macau citizen? Or is it because compared with other countries, Macau is not doing so bad, so we will just wait and see? We will monitor the situation at Macau, and so far there is no change in the policy. The government will continue to monitor the situation and adjust the entry policy based on a risk assessment approach. About the 52-year-old case, if a PCR test is not negative within the previous 28 days, we will make a report. Clinically, that deceased patient had a kidney failure and was and required dialysis. For immunocompromised patients, the viral shedding period would be lengthened. So when we conducted a test, there would be fluctuations between positive and negative results. So despite being unconfirmed case, we think that would be what most likely happened for that patient. Hi, I'm from Mingpao Daily. BA.2.12.1's case analysis is that there is a transmission risk in the community. How high is the risk? And you mentioned a vertical transmission in buildings. According to your announcements, many cases live in different flags on different floors. They were neither a vertical or horizontal transmission. So does that mean there is a higher risk? So for locally infected cases, how many are symptomatic? Do we have cases with serious symptoms?
And for the elderly homes, I'd like to ask about the Fanling and Lei Mok Shun. There are cases over there, but they're not yet traceable. Do you have any idea of how they become infected? Do you think it's through staff or through visiting family members? And lastly, how many police officers need to be quarantined regardless of whether they are the same unit? Thank you. Thank you for your questions. The first one on BA.2.122.1 on building transmission. At this moment, we identified many cases. Out of 250 local cases, 80 cases are untraceable, and there are others that are not connected to those cases. So for those without epidemiological linkage, we see sort of clustering in the buildings. It may involve 2 units or sometimes 3 units. Sometimes it's the upstairs and downstairs are different stories, but some are same units. Some share actually the ventilation shaft, and then so it might be due to pipes or other environmental contamination. And we see that in the BA.2.12.1, but we do not see it being a large-scale infection, because previously for BA.2.2 we have already seen it in some compulsory testing places. We see infections in different units facing different directions, and it may be because they use common facilities. So this is something that we cannot rule out, especially when cleansing is not done properly in the common facilities. BA.2.12.1 only account for a small percentage of all cases. Out of the 250 cases, we found many untraceable cases. Therefore, there exists transmissions of this subvariant within the community. These subvariant cases for sure would continue to surge upward. We are proceeding with caution because there is proof to show that there is an increase in numbers. After listening to expert analysis, with vaccination, it is still very effective against protecting against BA.2.12.1, and currently there doesn't seem to be any reinfection. I may not have the latest figures. There are currently around 55% people who are asymptomatic. That means 45% are symptomatic. But we may need to check the numbers to see whether these numbers have been updated. For the 2 elderly homes that I mentioned yesterday, we have arranged contractors to take PCR test for the elderly and the staff working there. Currently, there are no infections. It might be invisible transmissions. And they might be infected by visiting members or staff, because there's one staff who works in Union Nursing Home Come Day Center who went out on June 14th, and he may have become infected in the community. For the police cluster, as of today, there are 23 cases. For close contacts who do not live together, there are about 2 or 3. The police have not been gathering with people outside of their families, so only their family members will need to be quarantined. The press briefing ends here. Thank you.